everyone. It is time to head north. I am your host, Natasha Ryan, VP of Communications for the North Group, ex-news anchor, turned private security, now podcast host, to kind of keep my foot in this wheelhouse. I'm happy to have my friend Stacia Rivera with us today. She is the Senior Director of Security Operations for Providence Swedish. Stacia, thank you for coming on with us today.
Thank you for having me, Natasha. I'm excited.
I know, me too. We could talk for hours, but we're gonna try to limit this a little bit. Okay, so first of all, give the folks listening a little bit about yourself, your bio, your background.
Excellent. Well, background, graduated with the undergraduate from Central Washington University in safety and health management. And from there, started in construction safety. And then in 2004, I was given the opportunity to be safety officer at our Swedish First Hill campus. And it kind of just grew from there. Took on emergency management, actually got to work closely with our security officers, and fell in love with the work that our security officers do day in and day out, and was given an opportunity to lead them. Absolutely love the work. I love working in healthcare, and again, excited for this opportunity and to share kind of some of the things we're doing within healthcare.
And Stacia, like, I love your story because it's like ground up, and now you're in a management leadership role. So what kind of model do you think this serves as for a young woman coming into the security sector?
That is a great question. If there is one, actually, it's one of my stretch goals for this year, is to help guide, develop, and get more women in the security field. We actually, within healthcare, we have the environment of care. And that's kind of like all the ancillary kind of support from facilities to safety, security, emergency management, environmental services, huge group of folks. We don't have within the safety, security, emergency management and facilities, we don't have a lot of women. And more women are getting into it. And it is awesome to see. And if that's one goal I have, is to continue to develop women into that environment of care role. We need them.
We do. And because we offer different perspectives. Women think differently than men. So the question I always love to pose is like, let's hear your pitch for a woman that has never thought about private security as an option.
Oh, wow. Way to put me on the spot there. Security in the healthcare, setting, it's more than what, the traditional law enforcement or a military background, which is where a lot of our current officers come from. And that is great. But there is so much more within healthcare where, we're looking for folks that care about the mission, vision, and values, that compassion, that helping that patient from the time they walk in the door to the time that they leave. And I think that, as a woman, we're generally known for having that, that compassion and that ability to connect. And, again, not to overgeneralize, I think, but there's a spot for women within security and facilities and safety and emergency management. And it's a lot more open now. And there are so many more opportunities for women. And, the partnership with, our men counterparts, it's there, it's open, and it's time for women just to get into it, find that footing and just go.
You know what, you just said something that like ping, because people transitioning, specific women transitioning from past military, past law enforcement careers. There is, I always say the thing I love about this industry is it's filled with so many people that have that altruistic heart, that want to protect, want to care for, want to serve, right? Yep. So that is such, when you say like the mission of healthcare and caring for others, and that is such a wonderful transition piece that I don't think I ever thought about, that would be almost fluid for someone that's used to protecting and caring.
Yeah, it is. It's, I have been able to witness so many great events that could have turned out, you know, not good for anyone involved, but for the security officer that had that warm and open and inviting where they're just there to listen, they have they have truly changed directions for folks that if they had left the organization, as a patient, if they had left without that support, they may have encountered a completely different situation out on the streets that could have been, could have had a negative outcome. But I've had officers, help a distraught mom whose child was in the hospital, who was yelling and screaming, but just being that ear for them because, that mom or that dad, that parent is going through so much, and they are reacting out of that pain. And so the officers taking that time and just listening, laying boundaries, but being supportive, it has completely changed an outcome. And it is amazing to see it, to be able to see that and to know that, that whether it's a visitor of a patient or that patient has a different perspective, and that outcome is going to help their health in the long run. It's amazing.
This is such a good topic right now that we're in, because I just wrote something about how security officers can provide security, but they can also provide so much more if they are aware of the circumstances, aware of who they're serving, aware of even who they're protecting their clients from. There is an opportunity to build relationships, rapport with the people around, and that just makes them so much more effective at their job.
Yeah.
I mean, is that something you talk with your staff about?
Yeah, again, great points. I think one of the things that we've had to do over the last couple of years is, there was this mindset where you're trained to become a security officer, right? You get the uniform, you know the layout of the building, you know how to run the camera system, whatever those devices that are at your fingertips. But there's more to that, de-escalation training. Workplace violence is an epidemic across our country.
Mhm.
And, to be able to have de-escalation skill set, and, whichever model you're using for de-escalation, there are many out there. I think one of the things that we have done within, Providence Swedish is to add that trauma-informed care, trying to understand, a person is coming into our a patient's coming into our organization. They have things that have happened to them in their past, and that's coming with them, and that have involved trauma. And so trying to understand trauma to be able to make sure that how we're approaching a patient, and knowing that we can't change what had happened to them, but we can understand it at the moment and make sure that we are doing something with that in mind so that it doesn't cause additional trauma. And, some of the work that we've done around workplace violence is prevention, is recognizing that, the workplace violence is a symptom of something else, right? Whether
Right.
it's a behavioral issue, whether it's again, whatever trauma they've experienced outside, they're bringing in, that lash out, that violence is a symptom. So what are we doing to make sure that that patient has all of the resources they need to get care, to get better? And, if we can put in those mitigations, there's lots of mitigations out there, but if we can at least recognize, what are those symptoms and what can we do to alleviate those symptoms, you know, our goal is to see less.
Yeah.
And, I think the work that, that we're doing, that my workplace violence prevention team is doing, it's, I don't want to say groundbreaking, but I think we're going a different direction, and we're diving deeper. And I think
Root
that's what we have
cause,
to
root
do.
cause.
Yeah.
Yeah. So do you think more healthcare systems are going to follow suit and are actually engaging in more training, more de-escalation techniques. Do you see this as a trend right now in healthcare?
Absolutely. Across the country, hospital systems are putting this, it's a priority. I mean, I know it's a priority for us. If you're looking at literature, it's a priority for hospital systems across. I know that there are systems back east that have put in full page ads in newspapers laying out groundworks. If you're going to come into our organization and receive care, you are not going to harm our caregivers, our staff, right? These are our expectations. And and that's great. So yes, there's a focus on it. And I think for us that are, supporting our security departments, our security services, it's making sure we're sharing, because we're all learning different things. And it's making sure we have a place to share that, not looking at this as proprietary. Case in point, just based on this last year of data that we've been collecting, the model of de-escalation that we are using with the trauma informed care is if we are able to get our caregivers to the highest level of training, they are 400 times less likely to get injured in a workplace violence event. Now, that's something that needs to be shared. That shouldn't be proprietary, because at the
Right.
end of the day, our goal is for all healthcare workers to be safe. And, so finding those networks, that you can share that information. I'm in talks and communicating best practices with peers, from Utah and other places. And I think that's what we have to continue to stress.
Are you I love the sharing of
Yeah,
information. Share knowledge, share, right? It helps protect all of us.
absolutely.
Are you surprised at the uptick of workplace violence incidents we're seeing? Like it's no secret healthcare is in the top 5 industries that are targeted with workplace violence. So, are you surprised at the amount of incidents we're seeing, or do you think that it has been coming to a boiling point and now and everyone's starting to realize like the how it's handled and how it's reported has to change?
I think it's a both and. I don't know. We have Washington State's had laws for a better part of a decade around making sure you have a workplace violence prevention plan. There have been more laws over the last couple of years putting a little bit more teeth into that and making sure that you have a plan. I don't know it off the top of my head, but I know California is very, very prescriptive with their laws and what they are requiring hospitals to do. So I think it's not a surprise that we're having more events. And I think it would be an interesting look to see, are we getting better at reporting? Are we encouraging more reports to be filed so we see an increase? Or or is it really a symptom of what's going on within the world, right? And how, events that are happening across our country are also finding their way into the hospital, right? I mean, hospitals
Yeah.
are small cities. And, when we carry, when we have our day to day life, that doesn't just stop at the hospital entrance, whether it's emergency department or the main entrance, that comes with them, comes, and we have to be able to, again, help support in a therapeutic environment, for our patients to feel they're getting that support and that they can leave some of that there and still get that support. But then it's recognizing it's not just our patients, it's our staff, it's our caregivers that are also living out there and bringing things into the environment. And how do we continue to support them? So I
How
guess
are
to answer the question, I guess, you know, not quite sure, if we're looking at the data as it stands now, there's a significant increase, right? The pandemic probably didn't help that. Again, what's going on out there in our world is not helping it. So probably an increase, but I'd also say there's better data gathering as well.
You brought up reporting. How
Yeah.
do you enable your staff to report behavioral red flags, or can they recognize that?
Mhm.
And how do you enable your patients to report more?
Yeah. Some of the work that we've been doing around policies in support of reducing workplace violence, we actually have, within our de-escalation model, we have a whole list of pre-attack indicators. So training our caregivers to recognize those pre-attack.
Yep.
And dealing with those at that point before it becomes a full-on workplace violence event. We've had some success in that. We really have to reduce the burden of reporting for our clinical caregivers. They are doing so much. They have to document, highly regulated field, right? They have to document everything. So anything that we can do to reduce that burden, we want them to report it. We've started using QR codes where they can quickly, with their phone, take a picture of that QR code and get I think it's a 7-question web form where they can throw in some basic information. And then someone from our workplace violence prevention team gets in touch with them to get the additional data, make sure that they have the resources, whether it's from the employee assistance program, if they were injured, they got the workers' comp injury form. But we're navigating with them. They aren't alone. We're just not saying, well, you experience this, go find everything that you need to do and report it. Our goal is to really be with them side by side and navigate with them to make sure that all the reporting mechanisms are done. And I think that is something that we're going to have to get better at, because not only is it's getting us the data that we need to create the programs and find the mitigations, but I think most importantly, it is showing our caregivers, our staff, that we care, we want to do something to make their work environment safer, and we're going to. Right. This is us living that promise that we're here with you. We want you to have a safe environment to work in.
We're sitting here 4 months into 2023. From your perspective, what is the biggest security challenge on your plate right now?
I think it's two things that are, kind of keeping me up at night and, kind of working through. It's how do we embrace technology? How do we find funding for all the great technology that's out there that can help us? And also, how do we keep our security, if we're specifically talking security, how do we keep our security caregivers engaged and feeling supported? Because they are at the, we're talking about workplace violence. It's not just the clinical person by themselves. Security is right there with them, right? They are arm in arm dealing with this. So if I have a clinical caregiver that's been injured, more than likely I have a security person that's been injured as well. And there are some really great programs out there for supporting our clinical caregivers. We have to be just as good in offering those supporting mechanisms for our security officers, as well as making sure that we're breaking down that stigma of they need support as well. And what does that look like? Because keeping and retaining security officers it's not easy.
Yeah.
And, we are all, all the hospitals, I would just say within, Pill Hill, that we call it Capitol Hill, hospitals within the state up and down the I-5 corridor, we're all going after the same workforce. And, we have to continue. That's our challenge. That's my challenge with my team is we have to retain officers and we have to make sure that they're getting the support that they need.
That is a challenge. That's industry wide, right? Not just in the healthcare industry. You brought up like the mental health of the security officers. When you think about what they see day in and day out, life and death, people at their most traumatized, vulnerable state of mind, that's who they're interacting with. Do you see security officers, because of this uptick of violence against employees in your field and industry? Do you see security officers leaving because they are afraid to come to work?
We've definitely have seen that. I wouldn't say we've had an uptick. I think one of the things that we've had to get really good at is being completely transparent with what they are going to face within healthcare security. We've had an individual that, we thought we did a good job of explaining, and then within a couple of hours being on shift, they were like, "I'm out." Right? This is not what I thought it was.
Yeah.
And we have had to be really transparent, really blunt, saying this is the work. It's not easy, but there is support. We're going to make sure you have the resources. We're going to make sure that you're trained in de-escalation. We're going to make sure you have the tools that you need to respond. But it's definitely impactful. They again, that meant supporting, making sure that the officers feel supported at every level is critical.
I just wrote a post on LinkedIn about meeting up with a former colleague and like staying friends and,
Yeah.
working in environments where you feel supported and connected, and how important that is. You are someone that has the ability to foster that kind of environment for your employees, and you're also the person that helps hire some of those employees. So what are you looking for in your typical security guard? Like, what are some non-negotiables they have to have?
From my perspective, a security officer has to understand the bigger picture. Again, you can train someone to use the tools that we have at our fingertips, whether it's handcuffs, those physical tools.
Yes.
Those are all skills you can train.
Yes.
We are looking for someone that has a customer service background. Some of our best security officers didn't have any formal security training, but they came from a customer service background, and then they were able to pick up those additional skills, and they were amazing. I would say, right now, we I would say we had some struggles within the pandemic, coming out of the pandemic, of getting officers in the door. Everybody had security. They were using them as entry control.
Yeah.
And that
Yeah.
really depleted, our workforce resources. And now, I think as things have kind of mellowed out and opened back up, is we're starting to see an increase in the number of people that are applying for these roles. So we're able to have additional conversation. It's not just, at one point it felt like, oh my gosh, I just need a warm body. And that's not what we want, right? And, being able to find someone that, again, has that nurturing, has that ability to listen to what is being said, and then can communicate, those are crucial.
I love everything you've said, everything you're doing. Fantastic. Teaching your people pins. I mean, it's all great. So I want to shift back now to women in security. So because I know you are very involved in this field. I love it. I have a heavy hand sometimes in it. And I guess I'm interested in, you've been in security for how long? Remind me.
So I've been in my role, or some areas of my role, for about 19 years. And so I would say the last 10 years I've been heavily involved with insecurity.
Okay, so you've gotten to see years of progression or lack thereof, whatever your perspective is. And that's what I'm curious to hear. Like, how do you sit now as a female leader in the security realm versus how you felt even 10 years ago?
Yeah, I would say 10 years ago, I did not know another woman in security at all. And now, I have some strong peers. I'm blessed within the Providence Swedish realm to be to work with some strong women in the physical security roles. And I think it's growing as more, as what I've seen is, women that have gotten out of those, law enforcement roles, whether, FBI or, something else where they're looking, they're done with that, but they still want to be in the workforce. And I've
Yeah.
seen really great and strong women come to the healthcare security from that aspect. And I'm blessed to call them friends. I'm blessed to be able to, bounce ideas off of them. Again, more are needed. And I think that's where we just keep that door open. And also not just, those parallel or the, I guess, parallel job where I've come from being, in law enforcement as a, whatever role you're in, to now being a security director or security manager. But it's really on all of us, male, female, like all of us, to grow women from security officers into those leadership roles, and again opening the door to women in security, as get them in the door and then continuing to grow them up through that leadership.
And if a man is listening to this podcast and goes like, yeah, okay, I'm on board. I want to be, I don't know if the term ally is appropriate,
Yeah.
but you know what I don't want to use that, but you know what I'm
Yeah.
saying? Like, and they go, well, but how do I do that? Like, I have all men in my office. I have an all male guard force. Like, how do I actively make women a part of our ecosystem? What advice would you give?
I think there are areas where I can do better as well. And I want to be very clear, with those listening and, that may have questions. I don't think, I think recognizing that you can do better is half the battle. And then making sure that you're going above and beyond that. Are you creating an inviting, I guess, environment? One of the things that we recognize just, recently is we had our locker room. It was, both male, female, right? It was, it wasn't separated. And, we had a couple of our, female officers that said, I kind of like a separate locker space. And, well, why didn't we think of that? Right. Because there was a while where I think we had one, maybe two female officers. And, it was just like, well, we don't have a lot of space, but that's not on them. And that's on us to make sure that we're advocating to have the right space. So I would say for us within leadership, it's looking at our space and going, is this inviting? If I'm interviewing, a female and she's looking at this and going, wow, is there a space for me here? Look, here's this space that we've identified. Here's, again, having that warm and inviting, I guess, that feel to where it's not like, well, we're going to have to create this special space for you. It's already there.
Right. It triggered a moment where I just thought back to broadcasting, where my college professor was like, she was the first female reporter for one of the teams, the professional sports teams. And she's like, the men had a bathroom right there on press box level. I had to walk 4 floors down. And it triggered that, so to see the progression, but still recognizing there's more to come, there's more to go, is crucial to progression, right?
Absolutely. And I think it's not just stopping at, getting women into these roles. It's us being open from a complete DI perspective, right? From the diversity, equity, inclusion. And, we may, case in point, my team went through some really great DEI training just within the last month, where, walking through this process, we realized, like, oh yeah, we're inclusive, right? We want to make sure that we have a diverse workforce. And then after having some really open and honest conversation, it's like, but are we doing everything we can to make it inviting? Are we
Yeah.
doing everything we can? And again, having that recognition and going beyond just saying, of course we should be diverse, right? And but it's where are you putting, feet to the pavement, right? And actually making it more diverse, making it more open to everyone that wants to be in this role, because there is a spot for everyone. And I think that's for me, when we look at healthcare, could you have a more you are caring for an entire community that is so diverse. So having a space for that diversity within your teams, that's just going to help and grow your role within the organization that you're serving.
You said something earlier that I was like, that is genius. You said hospitals are little cities.
Hospitals are little cities.
I
And
never thought of it that way.
yeah,
So true.
it is very true. And everything that occurs in our cities that we live in is really occurring within the hospitals. And it's its own micro city.
I guess that makes you a city council member.
Oh, I don't know if I want that. Yeah, no.
I'm teasing. Do you have any final thoughts?
I want to thank you for asking me to do this. This is definitely not a it's not a comfort area for me, but I love work and I appreciate the work that our security officers do day in and day out, not just at my organization, but across this entire, Washington, the entire country. And, job well done to all of them out there. And, if anybody's watching this from healthcare leadership, go and seek out your security team, walk a unit in their shoes, get to know your teams, because they are truly there to keep you, your caregivers, the visitors, the patients all safe. And, get out there and meet those officers, because again, the work that they do, it's not easy, and it's hard, but they do a good job at it. So kudos to all of the security teams out there.
Great way to end it. Stacia, thank you so much for your time. And to all of you, if you want to hear more podcast episodes, just visit tngdefense.com. And until next time, have a great day. Thank you.